Hello, everyone. Welcome. I'm Christine Salas, the HTPA Community Director, and this is our HTPA Healer Development Series to deepen your healing touch practice. Today's topic is on insomnia and sleep disorders, and we have an amazing panel today of practitioners and instructors to share their knowledge, skills, and expertise with you on using healing touch to support those with insomnia and sleep disorders. A few things I want to mention before we get started. We are recording this event, so I ask everyone to please mute themselves that are listening in so we can make sure to hear the great things our panelists are going to share with us today. The recording will be available on the HTPA member portal. We will also be emailing it out to everyone that registered, usually in about a week. We will have time for questions, and we will save those for the end. And I will have you all put your questions in the chat box. And so that'll help me kind of organize and ask those questions to our panelists. And now I would like to introduce our lovely panelists. So we have Kathy Allan. Kathy is a board-certified holistic nurse who served as an instructor in the Healing Touch program and on the faculty of Beyond Ordinary Nursing, where she taught integrative imagery to nurses. In addition to Healing Touch, her energy medicine studies have included Rosalind Breer 3-year energy medicine training and the Foundation for Shamanic Studies. Her trauma studies include graduation from the Somatic Experiencing Trauma Institute, where she serves as an assistant in their practitioner training program, the 2-year touch training for psychotherapists, and 2 programs for healing developmental trauma, neuroaffective relational model, and neuroaffective touch. She recently served on the advisory group for the Crisis Stabilization and Safety Aid for Frontline Workers and First Responders at the Somatic Experience Trauma Institute. Kathy is a member of the Screen Actors Guild and has appeared in theater and in films. She also does stand-up comedy. Welcome, Kathy. Happy to have you here.
Great to be here with you all.
And then we have Jeanie Ballard. Jeanie is a Healing Touch certified practitioner and mentor, family organizational constellation facilitator, certified biological decoding psychogenealogy consultant, essential integration integrative healing founder and instructor, and a spiritual response practitioner, as well as a transformational coach and Reiki master teacher who is dedicated to bringing integrative therapies into mainstream healthcare. And she is passionate about empowering others to connect with their inner healing potential. Jeanie applies an integrative approach to support a client's healing process on all levels. She's gifted in working with cancer patients, chronic conditions, and inherited family trauma, and offers foundational support for those on the path of personal growth and spiritual development. Welcome, Jeanie. Happy to have you here with us.
Thank you. It's wonderful to be here.
And then we have Elizabeth Combs. Elizabeth is a Healing Touch certified practitioner and instructor in a student, healer, mentor, and a guide in the fields of energy medicine, plant medicine, yoga, and the expansion of higher consciousness on the planet. She shares her gifts with compassion and deep regard for her clients' own innate divinity and wholeness. Elizabeth envisions her role to awaken, nourish, strengthen, and accompany each one's inner healer. She is ever grateful to her many teachers along the path. Elizabeth enjoys daily walks in nature, chanting and singing, and playing her crystal singing bowls. She is pretty sure it is never too late to figure out what you want to be when you grow up. Elizabeth cherishes being a mom to her son Jack and a daughter of her parents Roma and Linda. Sleep is one of our primary built-in self-healing aspects. Treatment and support for both chronic and acute sleep issues is a major aspect of Elizabeth's clinical energy medicine practice. Welcome, Elizabeth. Happy to have you here with us.
Thank you. I'm very happy to be here.
And then we have Jane Hightower. Jane, who grew up as an Army brat living in Japan, France, and Taiwan, as well as many places in the US, but feels her true adventures began when she started teaching Healing Touch in 1992. Trained by Janet Menken, she was the 11th person to be certified as a Healing Touch practitioner and instructor. She is also a qualified mentor. She was a manager for St. Joseph Hospital in Augusta, Georgia for 21 years and the volunteer coordinator for Heartland Hospice of Augusta. She found another outlet for supporting women 35 and older in working as the executive literary editor for Cougar Magazine, which was a cyber magazine. Jane authored a book, Stone Empowerment, a resource for both the beginner and the adept. She teaches Healing Touch, Life Force Healing, Stone Empowerment, Reiki and Shaman Journey classes, and has a private practice. She is an energy healer for rescued wolf dogs and wolves at Apex Protection Project. Jane herself has sleep apnea and uses a CPAP machine nightly, so sleep issues are of great interest to her. Welcome, Jane. Happy to have you.
Oh, thank you so much. It's good to be here.
And finally, we have Cindy Palajac. Healing Touch has transformed Cindy's life. It eliminated a stress response that had bothered her every time she taught a workshop over a 10-year period. When Cindy took the Healing Touch Level 1 program in 1993, she learned how to balance her energy centers, calm her digestive system, and quiet her mind through meditation. This one course had such a dramatic impact on her life that she committed to learning more. Cindy became a practitioner in 1999 and an instructor in 2001. She now teaches levels 1 through 5 and the advanced practice for the Healing Touch program online for students in Canada and USA. Welcome, Cindy. Happy to have you here with us.
And happy to be here too.
So as you all can see, we have a great panel today, lots of experience here, and I'm sure we're all looking forward to hearing everything they have to share with us today on the topic of insomnia and sleep disorders. So I'm going to let them all share just a little bit more about themselves and specifically their experience in working with clients with sleep disorders and insomnia. And I'm going to let Cindy start us off.
Thank you, Christina. I found chakra connection has been my go-to for myself. For if I wake up in the middle of the night, I haven't had to use it more than twice to go back to sleep. And so I promoted that over the last 30 years with all my clients, and they've equally found that it's been beneficial. And I have to remind them, even if you fall asleep before you finish, it's okay. You don't have to finish the whole technique. The idea is to fall asleep. So, the benefit of our techniques from Healing Touch is that I often have clients saying after 1 to 2 treatments that they're sleeping better already, and that it just gradually improves as we help them to learn to understand how to balance their chakras, what relaxation feels like, and how to get themselves into a calmer, more peaceful place. Because often when they come, they're stressed to us. They have stressors in their life, and we have this beautiful box of tools that help them to sleep better.
Great. Thank you, Cindy. And Elizabeth.
So I have a lot of clients who have insomnia or sleep disturbance related issues, and usually they are really frustrated, and it's been going on for a long time. So what I've noticed is just in that first session doing chakra connection or one of the initial baseline treatments, chakra connection is kind of my go-to when I see someone for the first time. It gives that person, this is a lot of what Cindy was saying too, it gives them this sense of deep relaxation that they've many times forgotten that they can even relax. Insomnia can be just so deeply frustrating, and people are so tired. So I also have training as in Western herbalism, and I bring the plant medicine in a little bit. There's some just really nice tonic herbs, just the teas that you might buy in the grocery store, the herbal teas that can be nice assists for folks. And also as a long-term yoga teacher, just helping people with their deep relaxation. So I love all the tools that Healing Touch brings us, and teaching people that they can, when they wake up in the middle of the night, even just placing a hand on their heart and breathing. I have noticed with some folks, I can't give them too much at once. Like the whole chakra connection is like, oh my God, I have to remember that. So just like breathe, place a hand on your heart. And so kind of start with that.
Great, thank you. And how about you, Jane?
Well, when it comes to sleep issues, I've had very few people come to my practice purely because they were having difficulty sleeping. But almost every single one of my clients tells me, I'm exhausted, I'm tired, I have no energy. And so I have to be a detective and find out what's going on. Why aren't they getting quality sleep? And it could be physical, it could be emotional, it could be a stressor that's coming through their life, or one that's been living with them for a long time. But if it's physical, one of the first things they have to do is talk to their doctor about it. And have they done that? So that intake is so very important to find out, what is the history here? Why isn't this person sleeping? Why do they wake up 1,000 times at night? Well, they drink something like this at 10 o'clock, that's going to mean you're getting up at night. And but lots of times people think that a full bladder has awakened them, when in actuality a sleep issue has awakened them and they've become aware of their bladder. And that was something I had to learn about my own case. The sleep apnea there's something like 12% of people in this country that have sleep apnea. The obstructive kind, where the back of your throat relaxes too much, but there's also the central, and only 1% of people have the central sleep apnea, where your brain is not communicating to tell you to breathe while you're asleep. I have both. So, it could be a weight issue, it could be so much. So we have to be detectives to start out with these folks and find out what's going on really with them. Why aren't they sleeping?
Great. Thank you, Jane. And how about you, Kathy?
Well, I got interested in sleep disorders because I have a brother who is on a CPAP. He has sleep apnea, and a sister-in-law who has sleep apnea and is on a CPAP. And so I have done a lot of research to find out more about this condition. And I found that the sleep disorder research has exploded in the last few years. And there's a lot of information on the internet about what's causing it and how to treat it. And so I really set out to inform myself about the problem of sleep disorders. And some sleep disorders are pretty mild, can be due to stress, and then others can be indicative that there's a much greater problem going on, such as propensity for heart disease or strokes or clinical depression. So I keep that in mind when I'm working with my sleep disorder patients. And then my background is, I have extensive background in PTSD treatment. And so I attract patients who have had traumatic experiences. And so in evaluating those, then I can decide which one of the Healing Touch techniques would be most appropriate. And Janet was brilliant in putting together this program, because these techniques are absolutely fabulous and very, very helpful.
Great. Thank you, Kathy. And Jeanie.
I work probably about 15% of my clientele may have sleep issues. And I use the healing touch techniques as an adjunct to their care. Part of my training is in biological decoding and psychogenealogy. So after the intake, and I've found out what their medical records or medical history is, then usually we'll go into the biological decoding aspect to define what sleep disorders represent and discover where in their life they may be feeling these particular ways. And then once we do that, then I incorporate the healing touch protocols in order to integrate the information that's surfacing and integrating it into their body, because subconscious mind can't tell whether something's real, symbolic, or virtual. It will integrate it if it's a visceral experience. So that's the approach that I'm taking when working with my sleep disorder clients. But usually when they come to me, they're very stressed. They're at their wits' end because they're at the place where they're cycling, where they're not getting enough sleep, and then they begin worrying about not being able to sleep or getting enough sleep, and it becomes a vicious cycle for them. So we want to take care of the somatic piece by putting our hands on them and helping to assist them to begin regulating their body, because we're using our energy to override their systems. And then incorporating the other piece, whether it's biological decoding, inherited family trauma, because we also see family patterns will replicate in certain people, moving forward to a future generation seeking a better outcome, but people aren't aware that they've been nominated to heal this condition. So we have to address that as well.
Great. Thank you, Jeanie. Okay, so our first question is, what common intake, assessment, and energetic patterns, if any, do you find with clients with sleep issues? And Kathy, could you answer that for us?
Sure. Well, I just want to say that in 2004, I got Lyme disease, and I didn't know that I had it. I was just fatigued all the time. And when I was going through the Lyme disease process, I was having a really hard time doing the assessment. I didn't notice so much in the field. So I thought, okay, now what can I do then to make an accurate assessment? So what I decided to do after doing some research on sleep disorders, I do a very, very thorough verbal assessment and ask some of the questions that Jane was just talking about, such as, does it take them more than 30 minutes to fall asleep? Do they wake up soon after and can't go back to sleep? Do they wake up multiple times during the night? Do they wake up really early in the morning and can't go back to sleep? Are they fatigued during the daytime and have to take naps? And then also I want to make sure, do they fall asleep at inappropriate times, like when they're driving? So that's good to know. Do they snore? Are they snorting, having jerking limbs while they're sleeping? Do they wake up in the morning and feel like they just can't move, like they're not totally awake? Or do they have intense dreams? Now, and then from there, I move on to, how long has this been going on? What was going on in their life when their sleep problems started? And then what have they done that's helped them? And what have they done that hasn't been helpful? Now, this is all really good to know, in addition to needing to know the information so I can choose the right healing technique for them, but also it gives me information for at the end of the session when I give them a recommendation or a plan of action for them to be able to continue with their healing. So that's what I do.
Thank you.
That's what I did. And by the way, I'm over the Lyme disease now.
Good. I will be sharing as one of the resources a great list of questions similar to some of the questions Kathy just mentioned that Elizabeth put together for us. And so I'll be sharing that document later in the program and when we send out the recording as well. And Cindy, do you want to add to that?
Very similar to Kathy, with the intake interview for Healing Touch, it really only asks how many hours of sleep you have. So I also go more in depth and break it down to 3 areas. Do you have difficulty falling asleep, staying asleep, or wake up tired? And then, for example, if they say they have difficulty falling asleep, then I can focus on teaching them self-chakra connection, self-mind clearing, talk about, do they keep their phone beside their head while they go to bed, which would decrease their ability to sleep, and or are they on their phone or watching the news until they fall asleep? So we really have a good discussion about what is your pre-sleep routine, like how do you wind down, do you meditate, do you have a hot bath with Epsom salts, do you journal? You know, we really go into the self-care to help for that that problem when they have difficulty falling asleep. So I had one client, 20 years old, not getting asleep till 2 in the morning. And after one Healing Touch session with Chakra Connection and teaching her how to do that, she was going to sleep by midnight. And then by the second session, she was going to bed by 10 p.m. But one of her main issues was she was on the phone and she was texting and chatting with people until she went to bed and then ruminating about what they had said, because it turned out she had issues with being bullied in high school, and it was still plaguing her at 20. So she now sleeps through the night, doesn't have her phone in her room, and starts to unwind by 10 and falls asleep easily by 11. So it doesn't take long if they have that kind of, it's falling asleep issue, and you can get them to do the chakra connection.
Great, thank you. And next, I know we've already kind of shared some Healing Touch techniques that you all have found helpful with these types of clients. But I wonder, Jeanie, if you could just share a little bit more about the Healing Touch techniques that you use and what your rationale is. Why do you choose those techniques versus others?
Yes. The techniques that I will typically use will be opening spiral balance, for expanding the field of consciousness, and for deeper relaxation. And since it's 6th level work, in my opinion, as we're expanding the field, we're asking for guidance in that. Then I'll usually use mind clearing to clear, balance, and harmonize the brain and the cranial sacral energy flow around the central nervous system to promote feelings of well-being. I'll use the full body connection for deepening the experience of a comprehensive energy balancing facilitation of the healing process. And then in the Healing Touch advanced practice, I will use the double hand spinal balance because it works with the neurological system and it helps to relax the hypervigilant nervous system.
Wonderful. And how about you, Elizabeth?
Yeah, similar to Jeanie, I definitely use, and as Cindy mentioned, I use this chakra connection and full body connection and teach this self chakra connection. And I also have found that the spiral meditation on the heart is so gentle and really helpful. So it's good for those stuck and contracted aspects. Like I find that insomnia really is stuck in people often. So that's the rationale for working with that spiral meditation. And ending at the heart, I always close it back. I mean, sometimes when I work with people on other issues, I don't bring the spiral back in, but I do with my insomnia folks. And I want to mention as well, lymphatic clearing can be really, really helpful for this, especially chronic insomnia. So if we look in, because I bring in that herbal medicine and the traditional Chinese medicine training that I've had, liver stagnation is just associated with about every pattern of insomnia, leaving out some of those real physical aspects that Jane mentioned and so on. But it's really associated with almost every pattern of insomnia. So either just a sandwich technique I use a lot on the liver, or just hands still, hands in motion on the liver. The liver is just processing everything we take in, what we eat, what we drink, our emotions, our mental patterning, everything is passing through the liver. So it's really easy for the liver to get stagnant. And I have really seen a connection with that. So clearing the liver and then doing lymphatic clearing, I have found to be really, really helpful for folks.
Wonderful. Thank you. Next is, how often and how long are you typically seeing clients with sleep issues? How many sessions and typically the duration of the sessions? Jane, could you help us with that one?
Again, sleep issues are so complex, and being the detective, we have to identify where they're coming from to begin with. So I can't say that there is a certain number of sessions that it takes. What I will say is that many of my clients repeat every month or every 2 months, just as an update, but many don't. Once they're feeling better, they drop away. And I really do consider it my job to put myself out of business with each client as they get better and better and learn to keep their own energy system strong. So that's aura, that's meridians, that's the chakras. The Scudder technique is really a wonderful technique to help both clear and stimulate the major meridians, the 14 major meridians. And this can be very, very helpful with those clients. We have already talked about the self-chakra connection. We still have access to the chart that we can actually email our clients so that they have the pictures for that they can follow. It's not that they have to learn it from us the first time around. So I give that to all of my clients, whether they're experiencing sleep disorders or not. And seeing if they do that gives me a real good idea of how willing they are to do their own work. I'm thinking of a very dear relative of mine who takes her phone to bed every night. There's no way that I'm going to get her to stop doing that. And so you have to also identify with your clients, how much of teamwork are they willing to do? Are they willing to get the blue light electronics out of their bedroom? I had to move a air purifier out of my bedroom. So I put it in the room right outside my bedroom. And because it had a nice blue light on it that would shine all night long. So there's an awful lot that you have to work with that may have very little to do with sleep per se. One of the things I do is my practice with COVID has become completely distant now. And I'm treating people all over the United States and a couple in Canada. And that has brought a real richness to my development as a healer, because there are certain things that seem to come from different areas of the country. And I think a lot has to do with what's going on in their state or in their area of the country politically. I have noticed that is really affecting people right now. The division and the anger and the dishonesty that we're seeing all around us, things that are changing politically. There's a lot of fear out there. And so working with that kind of overshadowing stress, that's an ongoing thing. So that could take quite a long time. But I really I have an agreement with people who are having difficulty sleeping that I won't call them back when I'm through with my work, because if they're awake, they can call me within, it's going to be about an hour. So later in the day, they can call me back and we can debrief, or just wait until they wake up and give me a call back, because I don't want to awaken somebody who has fallen asleep in a deeply relaxed sleep. Sometimes it's the first time, I can't remember which of the participants here said this, but oftentimes we get people to a relaxed state that they haven't experienced in years. They have forgotten what that feels like. And that's an important part of this, knowing what you're going for. So.
Great. Thank you so much, Jane. And Elizabeth, do you want to talk a little bit about how often and how long you typically see clients?
Sure thing. Thank you. As Jane said, there's not really a way to define this because everybody is so particular in their pathway and what they're looking for and their partnership with me and with any other healthcare practitioners that they're seeing. So it really is, I just let it unfold for each person. But that being said, one session can really make a difference. And as Jane was saying, when people experience that deep relaxation, I mean, I do that in my distance practice too. I don't call people back and wake them up, because I know that they may be in that restful, relaxed, deeply restorative state for the first time in who knows how long. So one session can really just give them hope that they can care for themselves. So I'll stop with that there. I would say for people who really have chronic long-term insomnia and they really want some help with it, I sometimes have seen people a couple of times a week for a couple of weeks. And maybe after that initial intake session, which is a little bit longer, then it might be a 30 or 45-minute session for those 2 or 3 weeks. And then we move to weekly and then monthly baseline follow-up. So sometimes people do seem to need a little more, they're really entrenched with their insomnia, a little more support. And the lifestyle issues are so important because there's only so much we can do. I had somebody come to see me and I had really bad entrenched insomnia and she just wanted some herbs and some healing touch. And she was reading at night on a screen. That was how she went to bed, like reading her Kindle and having her phone by her head and not turning her ringer off. And she was the lifestyle modifications. She didn't really want to make the lifestyle modifications that are really simpler in a way and don't require as much intervention from healers or even going to the grocery store and buying a tincture or a tea. So it's just interesting to work with someone and see where we're willing to work. Caffeine, alcohol, those are also some other big things that impact our sleep. So those are and teaching the self techniques so that they can carry on. Like also, as Jane was saying, putting myself out of business. I don't want to just be seeing people over and over again for their insomnia. I'd like them to become their own best healer.
Yeah.
Great, thank you. Our next question is about common practitioner observations and evaluations that you find with these types of clients. And Cindy, could you answer that?
Sure. The type of clients I see with insomnia, what I've noticed, their energetic patterns are sacral chakra and throat chakra. And the clients that I'm seeing have their emotional needs not being met and not being able to speak up with their emotional needs. So whether it's physical or emotional abuse or sexual abuse, that's still they're processing, and it's impacting their sacral chakra. So they'll come in with digestive issues, but the throat chakra is also imbalanced, and then they'll say they're not sleeping, and they're not sleeping deeply, or they're waking up and not being able to get back to sleep. So that's the type of client that I see. And so the chakra connection or the full body connection and mind clearing really help them to get more centered and calm within, and just having that safe, sacred space to share their feelings and to be heard allows them to progress with their healing progress. So as I said earlier, 1 to 2 treatments, usually the sleep improves, especially if they do the self-care between the treatments, which I really encourage for them. And then they feel they have more hope. They have, when they sleep better, they can think better, and they can have dreams for what they want their future to be. And they learn, because they feel better within, they learn to speak up and speak their truth to people who are not being kind to them, or choose to spend less time with those individuals.
Great, thank you. And Jeanie, do you want to add to that?
Yes. What I find with most clients, and especially clients that have sleep disorders or insomnia, is that they really need grounding, because we're electric and magnetic. If they're mostly up in their head, they're ruminating and they're feeling vulnerable. And so we have to bring the energy all the way back down to the earth so that they can be fully in their body. And then what I observe about them energetically is that is the sacral chakra will probably be compromised, and the solar plexus, because they're not digesting the information that's coming in appropriately. And there'll be a lot of energy, often prickly and intense, around the head and also around the thymus, which I'll notice will absorb a lot of energy as I'm working with them physically, because the thymus is connected to sleep. In biological coding, we say the thymus is connected to the heart and to the thymus for sleep disorders. And then when performing the mind clearing technique, then I'll typically hold the occipital ridge for an extended period of time until I observe the client's body relaxing. And I'll just ask, please confirm that, I mean, to my guides, not to the client. And I'll notice that the client will lightly begin to snore. And they're still conscious, they're just in an altered state, and then move on to do whatever else I feel guided to do.
Great, thank you. Our next question is about common plans that you make with these clients, referrals, growth work, self-care. We've talked a little bit about that, but I'm wondering, Kathy, if you can expand on that.
Sure. And I would like to just add a couple of things. And one is about the Scudder technique. Now, we didn't really, years ago, didn't think it was that big of a technique, but actually it really is, because here, what happens when you're using the Scudder and stroking the body is that you're creating a delta wave, which is a very, very relaxing wave, and helps to reduce stress in the body. So I encourage the use of the Scudder. It's easy to learn, and my clients can do it on themselves, and they feel great because they're not spending a lot of money having another treatment and if that takes care of it for them. Now, I will say that I just want to mention that I have a patient who had long-term chronic stress. And so one of the things that really helps with that is to work with the adrenals. So I would do the full body connection and then include the adrenals in that. And then also I had that client keep the adrenals warm. And what you can do with that is they can use a heating pad, which I don't really recommend, but also they can get these pads that are cushions that are filled with flaxseed or something, heat them up in the microwave for a short period of time, and then put those on their adrenals to comfort their adrenals and to help them to relax. Now, I want to also say about a patient that I have who has severe post-traumatic stress, and she's in the acute stage right now where she's having flashbacks and nightmares, and she can't go to sleep at night until about 5 in the morning. So what I do with her is I tell her, that's great. You made it through the night. That's what you had to do to make it through the night. So I also recommended that she work with a therapist who can help her and to go slowly with that so that she doesn't get overwhelmed. And the work that we do, I do the healing touch trauma release technique, which has been very helpful for her, but I'm going very slowly with it because her trauma information is coming up too quickly and it's overwhelming her. So I want to go slowly with that. So that's just a couple of instances of working with clients. Now, what I do for referrals, it depends on, and for the plan, it depends on what's going on with that client. And I can have them come back for more healing touch. If their insomnia is caused by, simple anxiety, poor bedtime habits, too much electromagnetic frequencies in their rooms. But sometimes I'll think, this person should really be seen by a sleep medicine specialist. And so I will suggest that. Now, people used to go, many times, go to a sleep medicine clinic that was really very expensive. They'd go to the hospital and sleep there. They're all hooked up to different machinery. What we're finding now is that insurance companies aren't paying for that as much, and it really isn't that effective because it's hard for people to sleep in a strange, clinical, sterile environment. So I might suggest that they talk to their sleep specialist and do one of those home tests to find out what's going on with their sleep disorder. And I just want to mention that what they do for the home test is a device that hooks on to the finger and it stays on while they're sleeping at night. And what it looks for is their peripheral artery tone. How is that? Their heart rate, the blood oxygen level, the gross motor activity, which means the motor activity from your large muscles, your body position when you're sleeping, if you're snoring, and your chest motion while you're sleeping. So all of these can determine whether you really have a serious sleep medicine problem, whether you're dealing with respiratory distress, sleep apnea, or hypoxia, which is not enough oxygen in your blood system. So these are things that a professional can determine for that client. And as I said before, what they're trying to rule out is heart disease, stroke, and clinical depression. So these are all skills that I don't have. And I can use a lot of the healing touch techniques that we've already been talking about. But for those people who are not responding and still have sleep problems, I would send them to a sleep medicine specialist.
Great. Thank you, Kathy. And Elizabeth, do you want to add to that?
Sure. Thank you, Christine. So as Kathy was saying, all of those referrals are so important, and I know Jane might talk about that too. Again, that referral to a primary care physician or sleep lab specialist if you haven't already done that. I tend to not do those things right away unless I get a sense through the extensive intake that there may be a physical issue going on. What I've noticed with insomnia folks is they don't want another referral like right away. They want to have some relief, and so just working with them at least once or twice and giving it a little bit of time along with that self-care, the self-chakra connection, or the self-spiral is really nice too. Sometimes I use that one when I awake in the middle of the night, and I don't usually make it all the way around before I go back to sleep. So those, just working that with folks for a little while. And then if we're not getting the relief that they're looking for, making some referrals. I find that acupuncture is really helpful for sleep issues. And so I have a few folks that I like to refer to. But again, my practice is so distance based now that people have to find their own practitioner for that, because folks are so spread out. So I think that Scudder technique, the meridian based techniques, give us a sense of the connection with acupuncture. So that's one of those common referrals. And then in terms of growth work, the lifestyle modifications really fit in here. So if this little handout that I made for y'all that Christine's going to send out, just talks about all these factors that contribute to a chronic insomnia or even an acute insomnia. So looking at sleep hygiene, their practices at home, do they have a dark, cool, comfortable bedroom? Do they work in their bedroom, like maybe moving that around? If they do, having a consistent bedtime and wake up time, as all of us have mentioned, the screens, I think, and having the screens off at least an hour before bedtime. Exercise, I don't think we've really talked about that, but the importance of some sort of appropriate exercise on a daily basis is so helpful for insomnia. So a lot of times I've noticed that folks need some support. Maybe they've had an injury and they can't do what they used to do, and so they're just not moving at all. So helping folks figure out, or giving them that kind of growth work to figure out an exercise that you can do even though you're injured or even though you can't do what you used to do. Because just a little bit, I have found, really helps a lot with insomnia. And getting out and getting a little daytime sun exposure, it's also really helpful. It just keeps our circadian rhythm in a better place. It keeps our melatonin production supported. So encouraging people to get outside unless they really can't get in the sun for some other reason, but be outside even for 10 minutes in the sunniest time of the day is really helpful. So all those growth work things are important, and that's kind of growth work and self-care connected. And then follow-ups and tune-ups, invite people to come back on a monthly basis if they want to. And I have some clients who do that just across my practice, whatever it's for. And then some people, they feel better and they don't come back, and that's great. So I'm here when they do. So that's a little bit about some of the common plans and that I make with folks.
Wonderful. Thank you, Elizabeth. And I just want to mention that Elizabeth's going to have to jump off our call in about 10 minutes. I will be sharing all of our panelists, all of their email addresses. So if you do have questions for any of them, you can email them directly. I'm wondering, Elizabeth, before you jump off the call, the herbal teas that you mentioned, I'm wondering if you can put in the chat maybe some common herbal teas that you suggest to those that have sleep issues. I think our folks would find that interesting. And thank you.
Sure thing.
Okay, so our next question is about common client feedback that you receive after either the first session or multiple sessions. And Jane, could you share with us?
I really think one of the most common things that people say when they've experienced healing touch for the first time is, I haven't been this relaxed in years.
Mm-hmm.
And I try to get them to talk about that, to describe the experience. Were they aware of, some people see all these brilliant, wonderful colors, and other people, it's more physical. But I try to get them to describe exactly how would you describe that relaxation? What did it mean to you? Did you feel like you were asleep, or did you feel like you do in meditation, if they've shared with me that they meditate? And really get very specific in describing that so that it becomes something that they can work toward when I'm not there. And you can have this on your own. You can have this at night. Here are some things you can do. And then the self chakra connection, the self spiral meditation, doing that at night and not closing the spiral. It's going to close down within 15 minutes anyway, naturally. And they're not getting in a car to drive when they do that before bed. So it's safe to open it and leave it open as they sleep. But their comments can be that they connected. I've had quite a few connect with family members who have passed over. And that to me is really, really interesting. It's like, I got a message from my mother. And that's something that's happened, I can't tell you how many times, but often enough that it's gotten my attention. And that with these folks is not usually something that we're working on, or it's not that the person passed recently and they're in a mourning process. It's something that kind of takes us both by surprise when it happens. But that's not an uncommon thing for people to get in touch with a beloved on the other side, or with a guide or an angel that they see. And that to me is extremely interesting. And I encourage continuing with that communication at some level. What else can happen? I think the deep sense of relaxation is the most common, though, and is maybe the biggest blessing. But they've got to be willing to do their part when they go to bed, because I'm not there then. And that really tells a lot about how frequently I'm going to see someone. And at first I will tell them, I'd like to see you in a week. I would like to see you in 3 weeks. But after several sessions, then I'm asking them, okay, what would you like to do now? When would you like to? And I've been offering bundles to people to really bring down the cost of these sessions, and doing them from my home. I have no overhead, so I can afford to do sessions for less. And so I'll say, well, you have 4 sessions in your bank. What do you think would be good? How far out do you want to go? Are you ready to go monthly? And that, again, empowers and gets them very, very much involved in creating their own healthcare process. And I think this is very, very important.
Great. Thank you, Jane. And I love what you said about having the client describe that feeling of relaxation. I could see how that would be really helpful for them to really notice, right? What their body is doing, what their mind is doing, right? During that state of relaxation. So thank you for sharing that. And Cindy, do you want to add to that client feedback?
Sure. My clients find the same thing too, that the deepening of relaxation, or the awareness of what relaxation could be, and feeling at one with the table when they're on the table, and that they feel calmer and more peaceful, and that they sleep better after 1 to 2 sessions, and they sleep deeper. So I had one client who was wearing a Fitbit, so she would wear her Fitbit at night, and so it would record and tell her that she was getting 5 hours of sleep a night in deep sleep versus 3. So she was thrilled with the treatments, and then once she was getting more, like 7 hours of sleep, I said, well, now I'd like to encourage you not to wear the Fitbit because it's an electronic device that is working on your body. But it gave her that tangible reading of letting her know that energy work was working with her, and she was able to sleep deeper, better, woke up more relaxed. And then, when they sleep better, they have more energy during the day. They can accomplish more. They feel more balanced. That's the other thing they'll say is, I just feel energized, but not rushed. I feel balanced, but I'm not in a hurry. I feel like I have more energy to have some hopes and dreams. So a lot of people definitely do not know what relaxation is. They just know busy. And so we have that opportunity to help them and invite them into this relaxation stage. And that when they go from beta brainwaves to alpha brainwaves, the brain slows down, the heart slows down, the breathing goes deeper on the table. All these wonderful things can happen of them seeing colors or getting messages, and feel more connected spiritually.
Great, thank you. And now we would love to hear some success stories. And Jeanie, I'm wondering if you have one to share with us.
Yes, I had a client, a woman who came to me who had chronic sleep issues. She had seen her doctor. She had been to a sleep lab. She had taken sleep medications, sleep aids, but you can only take them for so long and then they're ineffective. And by the time she got to me, she was at the point where she felt like she was hitting a wall and she was getting up hope. So we were able to biologically decode not only what was happening to her life in present time, but to connect it back in history where, because I was asking her, how does it feel when you try to go to sleep? And she said she felt fearful. She felt vulnerable. She felt guilty about sleeping, or that sleep didn't have a value. There was no point. She should stay awake and stay alert. And that was interesting core language for her to use in speaking about sleep. So we delved deeper, and we were actually able to connect it to an epigenetic response that happened of a traumatic event that had happened to her grandmother, who had lost a child, and it had happened at night, and she hadn't been home. So because the egg that's going to become you is fully formed within your mother when she is 4 months in utero within her mother, then the stress hormones that get released to, and surrounding the egg every time a trauma is experienced, well, she happened to pick up that piece of the signal. And so what we did is we created not only the sleep protocols for healing touch, she incorporated the self-chakra connection, but we also helped her to create a ritual to honor her grandmother and also to release that response back to her grandmother. And the sleep issue resolved itself. And so that took 3 sessions. Generally, if I'm working with a person with sleep disorders, it's only really 3 sessions. And then periodically they may, 6 months, 9 months later, they may say, oh, I'm just having, a little bit of a sleep issue. And it's only 1 session and it goes back to regulating their system. So that was, a great experience for that client and for me. I'm so grateful to Healing Touch Program for the work that they've given us, because we really need that piece of helping to calm the body, to have that relaxation response, and for everything else, for all the other systems to come online to function appropriately.
Great, thank you for sharing that. And how about Jane? Do you have a success story you wish to share?
I do. I have what I thought was a fun one, in that this client has a daughter who has Asperger's, and the daughter had just started college, and the mother had a very high level of stress about, was she going to be safe? Was she going to be successful? How was she going to handle being away from home? Because she was, at a college at some distance. So she lived there in the dorm. And the daughter would call her at all hours of the night, because when she would think of something she wanted to tell her mother, she wanted to tell her right now, And so not only was the stress level of this woman making her sleepless, but she kept that phone right by her ear, her cell phone, so that she'd get these calls from her daughter. So in working with some of the environmental things that can cause the sleeplessness, I asked her to either turn off her phone at night or leave it in a different room. And she said, "Oh, I can't," and told me about the daughter. So what we decided she would do is she told her daughter that her healing touch practitioner won't let her have her phone in her bedroom anymore. So she bought the daughter loves Harry Potter. And so she bought this wonderful journal that's a Harry Potter journal. And so she calls it the Magic Journal. And she sent that to her daughter. And so she said, when you have one of your ideas or when you think of something during the night that you want to tell me, you write it in your Magic Journal and we'll talk the first thing the next morning or talk at a particular time of day. And you can read me from your journal all the things you thought of that you wanted to tell me. And it worked. It was just wonderful. The daughter loved the journal. She loved the idea of writing these magical ideas into her Magic Journal. But it was amazing how this one thing lowered the stress level of the mother so dramatically. And I think I saw her 4 times over a 3-month period of time. The first couple were close in and we came up with this idea, and then a month out and then another month out, and she was sleeping through the night. She loved not having the phone. It was like she was untethered, like whatever was chaining her and holding her had been removed, that she was free now. And this sense of freedom for the mother, it's not easy raising a child with those special needs. And her being in college now and being so successful, and a lot of the things that the daughter wanted to share were really happy, wonderful things. It wasn't that she was living in dread of receiving these phone calls. It was just that they would come all through the night. And the other thing she found out it did was it started helping her daughter sleep through the night. Instead of awakening with an idea and wanting to immediately share it, she would just jot it down in her Magic Journal, put it aside, and go right back to sleep. So this affected, the sleep quality of both mother and daughter. And I just thought that was kind of magical.
Yeah, wonderful story. Thanks for sharing that. And now, any challenges you faced that you wish to share, just anything else important that you think would be helpful for our listeners in working with clients with sleep issues? And Kathy, could you share with us?
Well, I think it's really important to be extremely grounded when you're working with sleep patients or actually any patients, because so many times what will happen is they'll go out of their bodies. And when that happens, there's a pull for you to go with them. So you want to make sure that you're real grounded and stay grounded throughout the session. That's about all I have to offer. Thanks.
Thank you, Kathy. So now we'll have some time for questions. And I know some of you have written some questions already in the chat, so I'm going to try to pull those out. But feel free to write any questions you have in the chat, and we'll try to get to as many as we can. Let's see. One question we had was, how do you train clients to connect the energy with the self chakra? Anyone wish to touch on that, Jeanie?
Oh,
I would say it's intention over technique. So that they should set intention to connect the energies and it will connect. After they've practiced for a while, they begin to sense it. And then, and they'll just know. They'll feel better.
Great, thank you. And Jane?
I will often share my experience when I first started learning healing touch. Level 1, I was feeling other people's energy. My hands could find all sorts of things. I couldn't feel my own. So I was doing self-chakra connection and trusting the process. And it was probably 3 or 4 months before I was able to feel my own energy. And I could then go to a pair of chakras and know, are they open? Are they balanced? Yes or no. And so when I share something like that with a client, then they don't feel less than. You know, so often the client will say, but I'm not feeling anything. I can't tell if they're open. Well, just at first hold it for a minute and then just start asking yourself and seeing if you get a yes or a no. And it might take a while, but trust the process. Trust me. I won't steer you wrong. You know, that sort of thing.
Mm-hmm. Great, thank you. And Kathy?
Well, what I do is I tell people that if they just put their hands on their body in different places, it probably isn't going to do too much. But if before they start the self-chakra connection, they connect with the healing power of the universe, because the energy that's going to be coming into their body isn't going to be coming from them. It's going to be coming to them. And as like Jeannie said, I tell them where you put your intention and where you put your attention is where the energy will flow. So if they're connected to the healing power of the universe, their intention is to bring healing to themselves, and their attention is on themselves when they place their hands in the different positions, then that will be very effective for them. And so that has worked really well for me.
Wonderful, thank you. We had Natalia kind of share a suggestion where she said, what about suggesting to folks to use the option to change their screens to filter out the blue light on those devices? I don't know if any of you have suggested that to your clients and if that's been successful, but she's saying that that may be a way to, you know, help with those that aren't really willing to separate themselves from their phones or devices.
I've just learned that that's possible. You know? So now I have to figure out how to do that. But I do have a client that bought herself, she said they're orange glasses that when she is reading on her Kindle, she wears the orange glasses and that filters out the blue light. But I have to now learn something new with technology. How do we do this now?
Yeah.
That's a great idea.
Great. Tessa was saying that menopause can cause sleep disturbances, and
Oh yeah.
what techniques can be used for those hormonal changes? Any suggestions there?
I find the full body connection works because you're connecting all the endocrine glands with it. And also mind clearing, you know, because it's going to help the endocrine system, and setting that intent for sleep. And then you know, a referral to a good doctor who's looking at what's the ratio between the estrogen and progesterone during those hormonal stages will really support the client. So I often recommend like a naturopath or somebody who's a specialist in hormonal therapy when people are going through that.
Yeah. Yeah, and I do the same thing. And I also let them know, I do a little education telling them that what menopause is their energy moving from their root chakra up to their brow.
Mhm. Great, thank you. Oh, go ahead, Jane.
When I was going through that, and since I'm 75 now, you know that was a little while ago, but I went into my doctor one day and I just screamed, "What are you going to do about these hot flashes?" And he said, "Go to the nearest health food store and buy Dan Quai and vitamin E." Dan Quai is a Chinese herb, and it worked for the hot flashes. So, healing touch is great, but sometimes we need other aids as well. Please remember that herbal medicine is medicine. Herbs have chemistry. They can interact with other things you're taking. So always check with your physician to make sure if you're going to start taking a new herb that it's okay and won't interact with whatever else you may be taking. But the Dan Quai and vitamin E, and I have now given that advice to both of my daughters who are going through this now, and it has helped both of them.
And another thing is that I found is to make sure that your sleeping environment is cool. And they have all sorts of technologies now, sheets, air conditioning, pillows, and find something that will help you to be comfortable when you go to sleep.
Great.
Pajamas that wick sweat away from you.
Great, wonderful. Another question is, if a client is on nightly melatonin, how to get them off of the melatonin? Or any thoughts about melatonin?
I'll usually tell them to speak with their doctor. I don't prescribe anything, and I don't, they need to speak to their physician or their holistic practitioner that is specialized in that, because I don't know what the interactions are with other medications that they may be taking, or conditions, if they have a kidney condition or a heart condition, or I don't have that background. So I stay within my scope of practice.
Great, good point. Okay, any comments about sleep inertia? No, okay. For those of you that haven't seen it, and I'll be copying this and putting it with the recording as well, but Elizabeth did give a really nice summary of herbal teas that she uses for sleep. And let's see. I think that is it as far as questions. Some of these other things are just comments in here. Oh, I see another one. Any suggestions for restless leg syndrome?
Using magnesium and self-chakra connection. So, and again, see a naturopath and see what are they deficient in that would support them. And even maybe reflexology, because reflexology would, calm the feet down, and it reflexes to all your organs in your body. So, but magnesium's worked really well for many of my clients for helping with sleep too.
So also I want to say, as far as restless leg syndrome, it's a possibility that that's the body's attempt to draw more oxygen into their system, to draw more grounding. And so what I've suggested is that the person get out and go for a walk, because when you're walking, your chakras on the bottoms of your feet are drawing up the energy from the earth. So that's one possibility.
Also, a warm bath before you go to bed can really help with that if it's an ongoing problem. Just last thing, a good, I would say a hot bath, not just a warm bath.
Great. Any help with fear of lucid dreaming? Any suggestions there?
A fear of lucid dreaming?
Mm-hmm.
Do they lucid dream, or is it just a fear of the dreaming? You know?
She wrote fear of lucid dreaming. I don't know if Teresa, if you want to clarify your question in the chat, and we can come back to that. Someone else mentioned, what are your thoughts about watching the news before bed?
Not.
No.
No. Never.
No. No.
I think we all
Only-
agree on that one and are shaking
Yeah.
heads.
Only if you want to have that replayed 10 times in your brain. Somewhere along the way, I read research that whatever you do that hour before you go to bed is replayed 10 times. So if you want the news replayed 10 times before you go to bed, while you're sleeping, that's what's going to happen. Your body's healing while you're sleeping. So you want relaxation before you go to bed.
And that would be the message that you're sending to your subconscious mind prior to sleep, which is telling you to stay awake and alert because danger is out there. Because they don't, it's not a good news network. They're usually telling you, sending negative information out.
And repeating it ad nauseum.
Yes.
And so what I've started doing is during the daytime, I'll go to my computer and I will just go through the news feed on my computer. And so I get the highlights of the news, and then I can decide if I want to click on a piece and learn more about it. But I'm not having the news pundits on television repeating, like I said, ad nauseum, the horrible things that are happening, and not a whole lot about the good things that are happening.
Yeah. Great. And Teresa did clarify about the lucid dream. She says, I do lucid dream and always wake myself. I'm falling and interacting with past loved ones. And for some reason, I have fear when it happens.
So I would say, Teresa, how can you befriend that fear, and what is the message that your loved ones want to send? There's beautiful books out there on dream analysis and questions to ask about your dreams. So perhaps journal about it and then look at, how can I befriend this fear, because perhaps these loved ones are attempting to give you a message.
And I was going to, and I reiterate about the journaling. I think that's so important. And if a lucid dream awakens you at night and you just quickly jot down a couple of sentences, close that journal hard, make a noise with it, and put it back down. And that is your putting that dream aside for now to go back to later in the morning when you're awake and you can think about what the message of that dream was. Also remember, as you're reading these books and all of the suggestions about interpreting dreams, that you dream in your own language. So, to one person, a snake is a phallic symbol. To another person, it's transformation. And so what do these things mean to you in your own language? But just jot that down at night, slam the book, put it aside, go back to sleep. You're closing, when you slam that book, you're closing the dream. You don't have to think about it for another moment until you're ready to go back to the journal and think about it.
So another thing you can do is have mind clearing, because what mind clearing does is it works on the nervous system, on the sympathetic nervous system that gets activated when we sense danger. And if you're fearful, then there's some part that's sensing danger within you. So with the mind clearing, that will settle the sympathetic nervous system and help it to relax more and let go of the fear.
Great, thank you. Some good comments here of those on the call that have restless leg syndrome. And I know that was a question, so I just want to read their comments. One of them said that a naturopathic help can really help. For example, she takes vitamin B12, and that really helps her restless leg syndrome. And then she also tries to avoid things like caffeine, chocolate, stimulants. Someone else commented that she tries not to take Tylenol or ibuprofen before bed, that helps with her a restless leg syndrome. So just wanted to mention those comments. Another question, that they have patients tell them that they only can sleep with noise, that there must be something else going on. Any comments about or suggestions with patients that need noise to sleep?
Well, guided meditation would be good if they want to hear a voice. There's also many meditations on YouTube that you can have for 528 hertz, the love frequency, or for any illness you have, you can have frequency meditations that you can download from YouTube. So if they need noise, then I'd suggest a guided meditation.
But is this just noise to go to sleep or to stay asleep? They may need to get something like one of those white noise machines, or you can set it for different things. You can have frogs chirping, you can have the waves crashing, and that would take you through the whole night. But I think you want something that's not going to put ideas in your brain. You want something that is calming and soothing, but not with words for the entire night.
Yes, good point. And the person who wrote that comment, that was Jeanie, she says that they use it to stay asleep and they usually use the TV. So I think, Jane, that's a really good point, right? If it's the TV, there's ideas that are being put in your mind. So a sound machine, a fan, sometimes putting a fan in the corner and just having that kind of white noise can be helpful too, is what I would think.
TV is also going to have flashing lights.
Yeah,
and you don't want that.
I'm sorry.
Yeah. Go ahead, Jeanie.
I was just saying, or at least have something that's positive going into your mind.
Yeah.
So if you need to have that sound, there's nothing wrong with it. It's just perhaps you could listen to something that's positive.
Right.
So that it's speaking to your subconscious mind and setting the tone for what your sleep will be like and what your life will be like.
Yeah. And like Cindy suggested, those guided, meditations, there are ones that are for sleep, right? And they have kind of a certain messaging and tone that they use for sleep. So yeah.
And breath work too.
Great. Another one, I think we have time, for one more. Their client's 2-year-old wakes up every night after sleeping 2 to 3 hours and then remains awake for 3 to 5 hours. And her client is naturally exhausted and doesn't know what to do.
Do healing touch on the child. I always did my kids magnetic clearing, quick chakra connection. They don't need more than 5 minutes. Massage their feet, massage their back. That'll get them to sleep and to calm down.
And she might want to look at whether this child needs a daytime nap anymore.
Yeah. Doing healing touch on the child. I agree with that. I've been doing healing touch on my daughter since she was a baby, and it's amazing how it really helps relax them. The other suggestion that I have that I use with my daughter is essential oils. And so, you know, you have to be careful of using essential oils with children. And so I encourage you to research that, but there are certain oils that are already diluted that are specifically for children, to help with relaxation and sleep. And so I'll just mention that. Let's see. Okay, I think those were all our questions. So thank you so much for those really great questions, and for our panelists to answer those. I'm going to put all of our panelists' email addresses in the chat. I'll also be including this when I send out the recording. But that's a way to contact them if you have any follow-up questions. I'm also going to see if I can add the file that that Elizabeth had made. Again, I'll also include this when I send out the email, but let me see if I can send this through the chat as well. There we go. So thank you all so much for being here today. A very special thank you to our panelists. I certainly enjoyed hearing all of your suggestions and experiences, you know, we will be sharing this recording, so those that couldn't be here live will be able to also benefit from everything you shared. So Kathy, Jeanie, Elizabeth, Jane, and Cindy, thank you so much for volunteering your time with us today. I'm going to be putting my email address in the chat as well if anyone has any suggestions or questions for me. Our next Healer Development Series topic is on surgical support. That will be on Friday, September 9th at 12:30 Central. We are having the September event on the second Friday of the month for that month, as opposed to usually it's on the first Friday. And of course, I will send registration information for that. And finally, if you are a certified practitioner or instructor or even retired and want to participate in a future panel, please feel free to email me and let me know what topics you would be interested in participating in. And thank you all for being a part of today's event, and thank you for all the healing you bring to the world. Have a good rest of your day.
Thank you, everyone.
Thank you.
Thank you so much. Thank you.